welcoming folks to the Healthcare as a Human Rights Conference and reminding folks about why it is that we're here. My name is Sherry Honkala, and I'm from the Poor People's Economic Human Rights Campaign. I'm the mother of 2 children, and I currently struggle, like many of you here in the room, on a daily basis trying to make sure that I don't get sick. Because anybody in here familiar with what it's like to have a toothache and not get it fixed? Anybody familiar with abscesses in your mouth? Having a mitral valve prolapse and wondering if you're going to get an infection that'll go to your heart because you can't go to see the dentist? Anybody familiar with playing doctor when you got pains in your stomach? A broken arm? Anybody familiar with the fact that when your child is ill and you have to make a diagnosis about whether or not that child is ill enough for you to take them to the emergency room, because that might be the difference between whether or not you can pay rent or your child may be too sick that something horrible could happen to them? Well, that's what this conference is about. It's about how do we go forward and put those of us that struggle with these questions each and every day of our life in the forefront of a fight for health care in this country. For this conference, we had 3 deaths organizing for this conference. And, you know, most other people don't have those kinds of obstacles, but we conference. I'm really excited. You know, the best thing about poor folks, right, is that they underestimate us. And that's pretty amazing. Because most people that go to conferences, they're able to just like get up in the morning and go to the conference. But when I look around this room, and I know the stories of the people individually that are in this room, those of you would be amazed. The people that are deathly ill, that got up this morning, that spend every single day of their lives committed to building a massive movement in this country. The people that are in this room that are currently homeless and don't know where they're going tomorrow, and yet help everybody in this movement. The young people that are here in this room that don't live lives of young people, but are actually seasoned adults. You don't know the stories of the people in this room. They didn't just get up this morning, get in their nice little car, and take a drive to the conference. They got up in the morning, they figured out their change. We scraped together in Sherry's hoopty, and we figured out how to deliver people here this morning. Am I telling the truth? And then we have our beautiful seniors who are still fighting the fight. Can we hear for our seniors? And something I think that you should always do when you're in the room is the woman who is responsible for making me the woman that I am today, the real woman that taught me how to make macaroni and cheese in 57 different ways, and who has probably gone through more heartbreaks than any woman standing in this planet, my mother, Jerry Overboard. My mother's the one that's really responsible. I was making jokes about her last night. She's over it, because she knows I make jokes about her all the time. You know, I said my mom could figure out a way how to have a huge natural disaster someplace and figure out something positive in the situation. And this is a woman who, you can kick her down the stairs 175 times, and I can guarantee you every 175 times she's going to stand up and she's going to get up those stairs.
I just wanted to say that for years I had heard a rumor in Chicago about the animals were being better taken care of than the people. And I thought, oh, people talk, that's not true. I saw the budget about a week ago, and it's true. The animals get $4,865,190. The people, mental health, gets $3,508,206. So it ain't right. It just ain't right.
It made me think about Demont Driver. How many people know the name Demont Driver? You should remember Demont Driver. He was a kid in Washington, a little boy, who had a toothache. And his mom tried so hard to get him to a dentist. Tried and tried, and she was on Medicaid. She had moved, and they wouldn't accept her card to get health care for this kid, for this little kid. So finally, after 2 months of struggling and working to get him to a dentist, finally she got into a dentist, and the dentist said, you know, this is very serious. We need to get him into a hospital. And they put him in the hospital. 6 weeks later, he died. He died from the infection in his tooth going into his brain. And that's what happens in this system. I mean, over and over, you all know stories like that. But Demont Driver's name we should remember, because he died for nothing. And we should never have people dying in our country. We have the money to pay for health care for everybody.
Just to give you a story, we're talking about health, and this is what we confront on a daily basis. I get a call, I got hurt at work, okay? They're gonna fire me because I got hurt at work, and there's people that get almost like limbs severed, and what they do, I warned at the beginning when I worked, I met a gentleman that almost got his thumb. They put a Band-Aid, and they gave him an ibuprofen and said, go back to the line, okay? And I saw the actual report by the doctor and signed by him, okay? So he was a smart man, he's a fighter, and he needed more support. And that's where I came in and supported and sort of gave him support because he's working, providing for his family, right? And so what happens is that he was able to not give up and fighting, but what people like that need is support, right? From people like